So the light is on. If I turn it off, it doesn't make any difference. Now
Turn it on. Yeah, with the
I've
light, it looks brighter, Ayushman.
okay. I think that I'll use it and I'll just like watching YouTube how to properly place that, and I'll just make a proper setup. So I'm using my mic, I'm using my camera, and I'm using my flashlight. What I got for the interview.
Yeah, it
So we
looks good with the light.
perfect. Thank you. So I just texted the group and then we'll start.
Okay.
A quick question.
Go
Have
ahead.
you guys discussed the experience section already?
Sorry.
Have you guys discussed already the experience section? Like tell me some bad experiences or some good experiences. Have you guys discussed that already or not yet?
The
I
question.
don't think so.
Yeah. Go ahead. Somebody wants to.
I don't think so. Like specifically good experience and bad experience. No, right, Ayushman? We haven't.
Haven't mentioned. We have just talked about. Is there any highest point and lowest point you feel? Then we just talked about, even one time we talked about if we had an altercation with our colleague, how will we deal with that? We haven't specifically talked about your good experience and bad experience.
Oh, okay. Thank you.
Question we can just take it like today.
That's a very recurring question my friends have been asked in every interview, and she was like, every interviewee that was interviewing her asked her that, one, how do you compare working from Pakistan to US? And second was that, tell me some bad experience and how you got out of it, and what is the good experience? Yeah.
Okay.
Like bad experience as in like professionally or it's like
Yeah.
personally as well?
No, professionally. What exactly they meant was that what experiences you had, any bad experience, and how you got out of it, and what you actually learned out of that.
Okay.
That's so good. Yeah, so Dr. Alisa just told, have we discussed a mistake? So Dr. Alisa, we discussed this question, and like I like personally, I don't have committed any mistake during my career, and like that's what we discussed previously as well. If we have some mistake, if we have committed some mistake, definitely we would mention that. We would like to talk about that during the interview. But we can just talk with us like some of the, if we are about to commit a mistake, but it didn't lead to anything big, and what we learned from that. So I like we can just personally talk about that example instead of, because I don't personally have anything I've ever committed a mistake. And if somebody even asks me if I have committed, I would just refrain from answering that question like particular mistake. But I can say that yeah, I was about to make a mistake. I made a mistake, but I learned from it, and I'd make the point that I won't make a mistake in future. Do we have Indu with us today? Okay. So, like the first question, like quickly we'll go through this part, and we can talk about other questions as well. So, yeah, as doctor, you mentioned about how will you compare the Pakistani healthcare system with the US healthcare system. We've already discussed that. Like, how will you compare your home country to the US healthcare system? So basically, the question arises from the same point, that why do you like the US healthcare system? So we can just compare that. If they ask, then we can compare those points with our own healthcare system, right? And we have discussed. If you want me to just repeat the points quickly, I can repeat those points because I've jotted those points.
Which day was that? Do you know that?
I think it was in starting,
Oh, okay.
one or two or third day, like it was something like that. But like if you want, then I can just quickly give you the points that what we discussed. The first point was the like ethics that are comparatively more followed in US compared to my home country. Secondly, I would say the multidisciplinary and holistic approach is, everything is followed more in US. That doesn't mean it is not followed in my country. And then I'll just add my line that policymakers are trying to incorporate more into our healthcare setup. Instead of saying that it is not followed in my country,
Yeah.
I would just say like that, all those points. Then there was one point that evidence-based practice in US and practice-based medicine in my home country. To be very honest, I searched about that on internet, and both of that means the same. right? So I will mention that point. If somebody knows how to explain that, they can just, after like I finish the point, they can just speak about that. Otherwise, I don't feel like I won't like speaking about evidence-based practice in US and the other practice in India, like practice-based medicine in my home country, because I didn't get anything from internet, like the difference between the both. So I won't be mentioning, but anybody wants to talk about that, they can talk after the points. Then one point was the EMR ethics. Then the third point was and the third point was a multidisciplinary holistic approach. Then I can say my home country, I had to work in the circumstances with the minimal resources, long duty hours, and I had to manage more number of patients in a limited time. So that added adaptability and efficiency in me, right?
Can
Then
we go ahead, please? Sorry.
and the next point is that in US, a doctor spends comparatively more time with the patient, listens to them, and give them the options and everything. But in my home country, due to the high patient load, they get comparatively less. They spend comparatively less time with the patients. Yeah, yeah. You can just go ahead. Yeah, like these are the points that we discussed.
And can we say that the documentation is much better because of the computerized system? And back home now, it's getting like the bigger tertiary care hospitals now have computers that they have the previous records of the patients. But while I was working there was like everything was on the paper, and
Yeah,
yeah,
that's a valid point.
people actually lose their lab results and their EKGs, and yeah, nothing is on the computer. Yeah. Okay. Thank you.
And one
But
more
your
point is
points were amazing.
in India, sorry, in US, the over the counter. Uh, just give me a second. I'll just talk about the question. Just to finish. Let me finish it. Then I'll go to the question. I'm so sorry. I like. So the last point is that in India, all of the antibiotics and over-the-counter medicine, they are readily available. But in US, we need a doctor's prescription. That's again a difference. Like apart from the over-the-counter medications, we don't have access to medication in US. But in my home country, we do have access. That even there's one more point that somebody told during the meeting, that in US, the appointment with a doctor is comparatively difficult. It takes time. Like it goes through a proper channel from a primary care physician, then the referral happens to a particular specialist. But in India, we can directly approach the doctor, and we can even get an appointment tomorrow, next day as well, depending on the availability of the doctor. So yeah, these were the points that we talked about.
Thank you so much. They're brilliant. Thank you.
You're welcome. So yeah, the question that Dr. R was saying was to compare the home country with the US healthcare system. So we had already discussed that question. I was just telling her the points of difference in both the healthcare settings that we discussed. Yeah. So so should we go ahead with the meeting now? So like we'll quickly go over the point, like what are the questions that we're going to ask the residents and the program director quickly, and I'll jot it down and write them in the group, right? So that we can memorize those questions, and during the meet, we can just ask the questions to the respective person, right? So can somebody just say what will they ask if they are sitting in a common room with the residents and they have to chat with them, or maintain a like a chat with everybody sitting there? What will be the questions you'll be asking? Like if you have to ask those questions to the residents. Dr. Lisa will go over that question after this for sure. That's a good question. Yeah, it has been covered. Yeah, but if more people want to speak on this, we'll cover this question. It's the most important accomplishment. Right, we can just go over that like quickly, like in 5 minutes, 10 minutes, we can finish these, and I'll jot it down and we can send in the group, and later we can have a list. Somebody just wants to tell like what questions they will ask the residents.
Like what questions we can ask the residents?
Yeah, residents first, and then we'll go to the program director quickly. Like what would you ask them the questions? I'll note it down and I'll send in the group.
Okay, so we can ask like what are the strengths and weaknesses of the program? Then what has changed since they joined the program? Then what else? I think you can ask about the area itself, like where they like, how far is the residential area from the hospital. Yeah.
Okay. Then I would say about the resident feedback, how seriously
Great.
does the program take the resident feedback?
And we
Any,
How
can
about
accessible is the faculty.
yeah, Harshita, I think your voice is breaking.
Can you hear me now?
Yeah, go ahead.
Yeah, we can ask how accessible is the faculty.
Okay. Okay,
ఆ
no,
నైట్ ది కొంచెం ఉంది కదా.
somebody wants to add something to this? How accessible is the faculty?
We could ask them about if the didactics are really protected time-wise.
Okay, we can just ask them the teaching structure, or like, what do you want to mean? Can you just clarify that? Because I'm noting down the points.
So I feel like the teaching structure is usually on the website, so I don't think they'd appreciate it if we ask something that's already on their website. We could ask them if it's because didactics are supposed to be protected. So we could really ask them if they really do get protected time for.
Okay, perfect. But yeah, we can, to the residents, we can ask the questions as well. But if you're a program director, we just have to refrain from asking these questions. But to the residents, we can ask. Okay, I'm just noting that point.
And can we mention that we can how are the residents, like which fellowships they go in, and what other if that's a level 1 trauma center, and what other pathologies do you guys see on your daily basis? If
Okay,
it's just a stroke, and yeah, one of the
basis.
residents told me these questions. Actually, she asked.
That's a good point. And then I'll prefer to answer like ask like how does the first month of residency looks like?
Oh yeah, that's a good question too. Yeah.
Then anything else?
We can ask them like to describe how is the relationship between the residents and the faculty.
Okay.
I mean, how supporting they are, and what they do when they feel they are overburdened or over fatigued.
Okay. That's a very good point. Then we can ask for the resident. What does the program have for the resident wellness?
Yeah.
And you're saying the relationship between them and the faculty?
Yeah, residents and the faculty. Actually, yesterday I asked this question to the residents in my
Okay.
interview.
Oh, you had an interview yesterday? Nice, congratulations.
Yeah. Thank you.
Any other questions you want to talk about? Like I have noted down 9 points. Like we can just have 10 to 12 points in our mind, and then we can just at least we have 3 to 4 when we have to ask. We just have 3 to 4 questions ready to be asked to the residents.
We can.
Yeah, go ahead.
Hi.
Hi.
We can ask some non-formal questions like food cafe, how's the food there, and just being a bit more casual than being really inquisitive always.
Yeah. Of course, like we can just ask if you get any this. If you get any money for the food, like how do you just put that? I just skip that word. If they get any
Stipend for the money but that's on the website, right?
yeah.
No, like how is the food at the cafe?
Okay.
Something
Yeah, exactly.
casual.
I will ask that question personally because the resident will think that he's here for eating only. So, yeah.
Like we can say recreational activities available for the residents, right?
Yeah, I've mentioned that point. The point resident wellness.
Okay, sure.
Right. Then I'll just write like recreational activities, mental health support.
One more thing we can ask is what made the resident to choose that program?
Okay.
Why they choose that program?
Recreational activity, mental health.
Maybe we can ask about apartments. What are the apartments available and what are the rents? And maybe we can ask about the strength and weaknesses of the residency program as well.
Okay, strengths and weaknesses. Yeah, I have noted that point. Somebody already told strengths and weaknesses of the program. I noted. And then somebody told about like what's the other point? Like what's the last point somebody talked about? I'm sorry, I missed that point.
The what
Yeah.
made resident to choose
Okay.
that program?
Yeah.
Why they chose that program?
What made residents choose that program? Yeah, so I've noted 11 points. Like I've already covered the strengths and the weaknesses of the program. We can ask that question, of course. Then yeah, about the research in the program. Like we can ask the resident this thing. Yeah. Anything else? So I'll just repeat the points quickly. The first point is the strengths and the weaknesses of the program we can ask. Then we can ask about how seriously the resident feedback is taken in the like how seriously the resident feedback is taken in the program. How accessible is the faculty if didactics are protected? Then we can ask about the place and the surrounding area, resident wellness like recreational activity, mental health and relationship with the faculty. How is food at cafe? What made residents to choose that program? The research and the program. Anything else? Like already there are 12 points.
Um, how would you describe a resident that would fit well among the resident group?
How would you?
How would you describe a resident that would fit well in among the resident group?
Okay.
And do residents get to choose their mentor, or are they assigned one?
Yeah, I have one more question. We can ask them that how residents are evaluated, how they get evaluated, and how frequently they get evaluated.
How residents are evaluated. Okay. Perfect. Then 15th point, I can just talk about like if somebody doesn't ask what's the structure of the residents, how the program is structured, I would ask them because like if there are 5 to 6 of people and everybody asks 2 questions, then I'll be falling short of the questions, right? So even I won't mind asking them what's the structure of their residency or the first year looks like.
Can we repeat the questions between the residents or no?
Of course, like I don't know, I haven't given any interview, I have no invites yet. But what I think is in a common room, all of the like the ones who are going to get interviewed on the first day, like Nisha, do you want to talk about this? Because you had an experience yesterday.
Yeah, actually, I think we get only yesterday, along with me, we are all together 10 people. Everyone had a common, I mean, all the residents, they give us time to introduce ourselves. And I think maximum we can ask 2 questions. They gave us one hour of time with the residents. Yeah, 1 and 2 questions are enough, I think so.
Okay, perfect. And
It's not good to repeat the questions, I feel. Yeah, because along with the residents, there will be definitely the some other people who will be listening to us. So yeah, participation is necessary, but it's not advisable to repeat the questions.
All right, thank you.
Perfect. Yeah, thank you. And do you want to tell anything about your experience? How was the whole experience? Like briefly, 2 or 3 minutes you want to tell? Like, but because many of us didn't have the interviews yet, or like we have interviews scheduled later on. So if you want to tell, like it can help us like in some way.
Yeah, definitely. Actually, I was so scared because this is the first time being an IMG. We never face interviews. So yeah, starting it was so I was so scared, but later I was so comfortable. Regarding the question, what we discussed in this group mostly are repeated. I mean, many of them were so helpful for me. So yeah, and major of my questions are on behavior. most of them. They gave me the scenario questions. They asked me that a few logical questions like if you are part of a nature, what you want it to be. You would be like rather be liked or rather be respected. And two scenario questions. Yeah, most of them were like, what are your strengths? Tell me about yourself. What when you what is the situation where you felt so difficult to handle in your medical school? Most of them are same. Everyone asks the same strength and weakness question and describe yourself. Why this specialty? Why this program? Most of them ask me the same, but behavioral questions were a lot at the coming towards the end. Yeah.
This was in-person interview. Sorry, I joined later.
No, it's a virtual interview.
Okay,
But
thank
which specialty was it? IM or
No, I gave for family medicine.
okay?
So, Dr. Nisha, somebody told, can you repeat your first question if you were?
I mean, what they asked me or what I asked
The
them?
question, I think somebody missed that question. Like Saraswati, Dr. Saraswati asked in the chat box, what are the first question if you were question mark?
What I was question first was, I'm
Your
from
question,
San.
like somebody
My
asked,
question,
the question,
for residents, I asked them to describe the relationship between the faculty and the residents.
the question during the interview, like somebody asked you if you were. Yeah, is Dr. Saraswati saying any behavioral question?
Yeah, behavioral questions. They asked me about the disagreement with my colleague, difficult situation for me in the medical school, and yeah, they gave me two scenarios. One was um I forgot my question. Sorry. um, let me. I sent the questions to my junior. Let me.
Said something
Sorry
about
for
H.
that. Yeah.
You said something about HR.
Oh, actually, she told, I think, describe yourself if you want to be part of nature, something like this.
Yeah, nature. They asked me what element, if you are an element in a nature, what you would be. Yeah.
That's again like somebody asked me like
Are
what
you?
answer.
I'm sorry. Are you supposed to answer like I would be the sky or a tree or
Yeah,
like a river? Is that
definitely.
what I don't
Yeah, yeah,
understand.
yeah. Yeah, that was the question actually. I
Oh,
was lucky enough. I prepared for that. The before night, I answered it according. I mean, my answer was I would choose to be a land soil because according to Indian mythology, we say that land have a lot of endurance and patience. So I would choose for that because of we as in this profession need a lot of patience. So yeah, my answer was that. And they
I think
asked me the another question was, would you like to be liked or respected?
like the respected. Okay.
Yeah.
Then what did you
What
say?
do you guys? I said that I would be liked because respect can be faked. And like when somebody really like us, they automatically connect to us emotionally, and there will be a bond which leads to a respect. So I would be rather liked than respected. Yeah, that was my answer. I don't know how
That's a
good
very
was
good
it
answer.
is,
That's a very, very good answer.
but it was so spontaneous actually.
No, it was very, very good answer actually.
Yeah. Mm, yeah, my question was they put me into two
But
scenarios.
I think my answer will be reverse because I will say
Same here,
I
same here.
like to be respected because respect is earned. Light can be sometimes biased, so I will choose to be respected.
Yeah, it's like individual answer. Like
So you can just justify your own answer. Nothing like
yeah,
right or wrong.
yeah, every answer is correct.
Yeah,
Yeah.
As
absolutely.
Dr. Aishman says every day, every answer is correct. There
Nothing.
is no
How
wrong
long
answers.
It's an
how, do-
individual thing. Yeah.
how long to prepare for the interview? How long it took for you to get prepared for all the questions? Like 15 days, 10 days, or a month? So in order to, as we are,
Seriously, to be honest, I think I applied one week before for the interview, and I was every day I was in this session. I prepared myself. I won't say 1 week. Yeah, mostly 1 week, I think. I'm not that prepared, but yeah, I somehow I managed it.
okay, thank you.
Shall I give my scenario questions?
Yeah, just go ahead. Like, everybody wants to know like what questions you were asked.
Yeah, one scenario was if you have a person very close to you, you know them very well, and they were recently diagnosed with a life-threatening disease, and they are not ready to take the treatment. How would you deal with that?
Yeah.
One was that, and second was that during your I mean in your rotation, or if you are a resident, you have completed all your work, everything is done, you're going to leave, and suddenly you are attending gave you a new case to present all of sudden. What will you do? Yeah, these two are the my scenario questions. Hmm.
I think these two things are common in India. So
Yeah.
Can you share
Yeah.
what you said, Dr. Nisha?
Yeah. Um, for the first question, I said that I would definitely take the advantage of my relationship with the person, and I would first emotionally support them, because it's very difficult to digest the diagnosis of life threatening. So I would first emotionally support them and later explain them, take time and explain to the person and their family that there is a how what are the advantages and disadvantages of being treated and not treated. And I would definitely give my complete support, rather it be emotionally or financially, and I would take care that the person get completely treated. And yeah, I would support for even high level of care if the person needed. That was my answer. Not accurate, but yeah,
No
almost that
answer is
was my
wrong.
answer.
No answer is completely perfect, and no answer is wrong.
Yeah, I mean, I can't remember my
It's your
complete
confidence
answer.
that you
I
wear
was like,
that. It's basically your
yeah,
confidence that you're going to wear on that day, right? And that's going to, and that's how you're going to ace your interview. Even if you say, I don't know,
but
I never thought about that, this question, that's fine.
yeah, it was spontaneous. I mean, I can't remember what completely I said there because
actually,
it's so
it's tough question
spontaneous.
also,
Yeah.
because the answer is right, but this was a tough questions also, because uh, just to make them understand, especially who is not willing to take the treatment, it's not that easy also. So yeah, we need to only
Yeah,
modify.
because of that, I started my answer that I would definitely take the advantage of the relationship. The opening line was same. That was my opening line, and yeah, the interviewer appreciated actually for that answer.
It's a good
Yeah,
answer.
it's good that because it's an emotionally draining for both me and for the patient, because we have that bond. Definitely, it's emotionally draining to me also. So yeah, I said that one. And for the second question, I said that definitely I would take some time because I can't present a case out of a sudden case which is new to me. So I would take some time. I would request the attending to give me some time, go through the history of the patient and have a brief talk with the patient about the symptoms and everything, how it started, and later I would definitely present my case and leave after that. That was the answer for my second question.
Okay, perfect. So I'll just write down these questions and I'll send in the group, like the questions you told. I won't specify your name or something, but I'll tell that these were questions that were asked to somebody in an interview recently, so we can prepare that as well. Thank you so much, Dr. Nisha.
Yeah,
And even the question
it's my
that you told, that how will you handle a difficult, like your relative, like similar questions somebody even discussed here with the, like how would you manage a patient who has lost trust in the healthcare or who had a bad interest, bad experience with healthcare. So it's like a little bit similar question, but yeah, when it's a
Yeah.
close one, then we can use the advantage of a relationship with that question for sure. Right. Thank you so much.
Yeah.
So so the questions that we're going to ask the residents, so we have noted the 13 points. I sent it in the group. 15 points we have noted. The first is the strengths and the weaknesses of the program that we can ask residents during a common meeting. The second one is about the place in the surrounding, resident feedback, how seriously it is taken in the program, how accessible is the faculty, if the didactics are protected or not, like if somebody is getting a chance, they're getting an equal time to attend the didactics or not. Pathologies they see on a daily basis. First month of residency, how it looks like. Resident wellness like recreational activity, mental health, relationship with the faculty. How is the food at the cafe? What made the residents choose that program? Research in the program. Do residents get to choose mentor or are assigned one? How residents are evaluated in the program? And what is the first year of residency? What first year of residency looks like? Yeah. Anything else you want to add? Like if you get a chance to ask president, I can just note it down and later send out.
There was one question that I read a while back, Ayushman, which is basically, what will the program do to support you in helping you study for your board exams? Because there are board exams at the end of every year, right?
Perfect.
So I think that's a good question to ask the residents. Like, will you be given some time off? Like, will they work like internally within the the scheduling system to give you some time to study, or does the university or hospital have some resources themselves that like they can offer to you to help you study for those exams?
Okay, that's a very good question. I've noted that. Yeah, thank you so much, doctor. Anything else? Anybody want
Mostly
to...
type of questions about the education, I think, is available on their website. So it's most important to check the website first about the educational financial support from the program, because mostly program do support and they have written everything in their websites. So it's basically very important to know it from the website first.
But I think Dr. Om is not talking about the financial aspect, but he needs to say, like, if we get an off from the, like, off for some days to prepare for the board exams, like, kind of emotional support, emotional element of that support, like, do we get something off from that, or any, like, program has the resources to teach us for and prepare us for the board exam, something like that.
Okay, that's good.
Anything else? Like we can just shift to next question. Quickly, we can discuss these questions, like what Dr. Nisha recently told. We can just discuss these questions also.
Okay, and I have two extra questions I spent to add, like one specific for pediatric. Like I would like to ask if there is a like pediatric interview, that what are the future adaptation or modification in your curriculum you are thinking to have to address newer issues in pediatric age group, like mental illness, gender identity crisis, attention deficit, or some newer syndrome like internet syndrome, television syndrome, like this. This would be my first question. And another will be, is there any unique events or unique steps your program is taking to build leadership or to support or encourage leadership skill in residents? That will be, and creative skills. That will be like second. And third question will be, I don't know it is appropriate to ask or not, but I want to just share that how your program is thinking about the incorporation of AI and like technologies like robotic surgery in place of human resource and human skill, along with some positive outcome and excellent result. Is there any major drawback your program is thinking for long run, like breach in data secrecy or increase in unemployment or misuse of data for power and authorization? Like this way, I'm thinking some critical question, but I don't know it's appropriate to ask resident or not. This third one.
Right.
And last one is is there what are the good locations like for traveling nearby?
Okay, yeah,
Okay.
I've mentioned about that. Yeah, the place surrounding area, like do we
Yeah.
have the public transport system and everything? Like we can just ask these, how's the surrounding area? Do we have the places where we can go and to just relax? Do we have nearby places? Okay, right now we are done with this. So quickly we can just go over.
Ayushman, I have a question. So, you know, like many people will be would like to visit their home country at least once a year. So definitely there must be some guidelines for how many days off we get in a year or something. But should we ask them, like, could it be a potential question like how many days or when I can visit my home country? Can I visit once a year? Like how will we rephrase this sentence?
I think honestly that the question of like both salary and vacation days, I think I've seen in almost every program's website. Like they listed very clearly. I think it's very clear to the point that I think Residency Explorer itself tells you their salary and like how many days you get off, if I'm not mistaken. I'm not sure about the days you get off, but like I've definitely seen it on every website. So if you so I think like Dr. Talpur, I think her name was. I'm sorry, I missed it when she said it, but her point was very correct in that all of these questions should be. You should think about asking these questions after reading their website, because there's a huge turnoff if you ask. Because they actually like very specifically like list that please don't ask questions where you can find the answers on the website, because
Yeah,
uh,
absolutely,
Yeah.
absolutely.
sorry.
So into like what you can ask them is like one question we can ask of course with the residents. The question you're asking, we cannot directly ask how many vacation days they're going to give us, because these are everything is available on Residency Explorer. But you can just ask them. Suppose I want to go on a vacation in January. If I have a plan or something, I want to take that vacation in January, right? So how many months
For some
before I
reason
have
we
to
can.
ask for the permission? Like how many months before I have to inform the program about this?
Or we can rephrase like this, like if something happens, some emergency happens, and I have to go to my home
was the
country,
question. Yeah.
is it allowed? Like something like that. Okay.
If I'm given a chance to ask the program director, suppose an emergency happens, how would you deal with that? And resident has to visit a home country or his home place or his hometown. How will the program handle that?
Okay.
That's a very legit question. That's the question. I just noted down. Yeah.
Yeah.
What about
Asking
about the
about the
maternity question? Because I'm really concerned about it as being married, and I've heard a lot of residents don't get maternity leave. They just have to access their 4 weeks, 4 weeks, you know, whatever it is, yearly situation. They have to handle it, and then afterwards, even after the cesarean section, they have to join. And sometimes they take breaks and you know, extend their residency. So, what about that question?
ask, like if you're a mother, like you are, or like you are expecting to have a child, and you could definitely ask these questions. Like a female who's married and who wants to, you know, they can have a pregnancy anytime. Like they can expect anytime. You can just ask how will program take that thing. Like how supportive will be the program.
Exactly, because that is never mentioned on the websites.
That's right.
And yeah,
that's a legit question. You can ask the residents about that.
I think sometimes that answer is also mentioned on the website because I was looking at one of the programs and they specifically mentioned that they give 6 weeks of maternity leave. So maybe just verify first from the website, then ask this question.
Yeah. After first we'll go to verify. We'll just go and read the website and then we can just write. Yeah. So Dr. Nazma, we are just discussing the questions we can ask the residents. To the program director, we will never be asking these questions.
Sure.
Yes, like we are next we will do that question only. If you want to ask the program director questions, I'll just note that down. But we won't be asking all these questions to the program director because it doesn't look nice. For the whatever I know so far is that with the residents, it's an informal kind of meet. Like somebody told me that during the meet, the residents will be at home. Like probably they'll be at home, so they'll be in a chill mode. But with the program director, it's a very formal kind of thing, so we can't be asking these questions. We have to be very limited to certain questions only. Okay, yeah. Now we are done with the this like the resident questions. I noted down. I just sent it the group. We have 18 to 19 questions. You can just read that once and keep that in your mind so that during the meet, whenever it happens, hopefully it will happen soon. So whenever is the meet, you can just out of that 18 points, at least your 18 questions, you're just prepared with 3 to 4 questions, which we can ask the residents, so that we can just continue the chat during that meet.
Will you send them on the WhatsApp group?
Yeah, I noted that down. I just send after the meet.
All right.
Okay. So, like, can we go with the questions? We are going to ask the program director.
My question was, uh, are the residents permitted or encouraged to attend the regional or national medical conferences? That was one my question to the program director. And another question was, how is the mentorship model?
Okay, like you're saying, how will, like, if I'm in the first year, how will the somebody there be support me? Like, how will somebody support me during my first year? Something like this.
Yeah, actually, they have a model for mentorship. Actually, I don't know that. He explained me completely that before we join, I mean, when we get matched, they will assign a mentor for us because it's different area and everything. They'll take care of that. And when we start our residency from July 1st, later on they will assign a mentor, and we can share any problem of us with them, anything we are facing difficulties, anything, I mean, our personal or academical, anything we can share with them. And they said something like they have a CC committee, they take the feedbacks from all the residents, mentors. He actually explained everything for me. Yeah.
Okay, the mentorship model.
That
Okay.
two were my questions.
Okay.
Yeah.
Can you repeat question?
Yeah, definitely. My first question was, are residents permitted or encouraged to attend regional or national medical conferences, like CMEs? And second one was, how is the mentorship model in their program?
Allowed to attend the regional or national conferences. Okay, yeah. Okay, perfect. Conferences. Yeah, I've noted down the questions. I've noted down the 28 points. I'll just share in the WhatsApp. I've noted it down. After the session, I'll share in the WhatsApp group, both the groups like we have. I'll share it over there. Yeah. Thank you so much, Dr. Nisha. So, like the program director, the questions we can ask the program director. So I have the 5 questions which we discussed here. The first question is like we can just ask them how they're going to evaluate their residents. That's a very obvious question. Then we can just say we can ask them, if you want to change something about the program, what would that be? What do you expect from your residents is another question. Yeah, they are not like there are not much questions available here. Like if somebody wants to add, I can just note it down and I'll share in the group. Like if you want to ask your program director the questions. The 2 questions that I got from YouTube were if you want to change something about this residency program, what would that be? And the other questions, how would you evaluate your residents, or what do you expect?
So other question can be the how is the burnout and the overall environment of the residency program, because the burnout questions are very important, I think.
Okay. Anything
Or
else?
maybe we can ask the burnout question from the residents because
Okay.
they are more burnout.
Yeah. For that, yeah, definitely you can ask residents. Anything else you want to ask from program director, you can just say.
Okay, I have a couple. One, so one of the other participants, the doctor, she mentioned the question about AI. I think that's a better question to ask the program director than the residents, because implementing AI is like a program director, head of the hospital kind of thing. They would know better and they would be in a better position to answer that question. So I think the AI question can be asked to the program director. And the second question that I wanted to ask was again the same thing regarding um how would the program support, what does the program have any structure in place to support people applying for fellowships, to train them, or to kind of build their own CV up, if they know that they want to say go into cardiology, will the program help them during their internal medicine residency only to kind of target their CV with maybe cardiology research or cardiology experiences, something like that? That was a question I had in mind. Maybe it could be phrased a little bit better, but yeah, this was something that I thought could be asked to the PD. What do you guys think?
Like I would ask, but depending on the program, like I would refrain from asking this question in a community program. That's me. But anybody else wants to add something to this? Like it's a good question, but I would refrain from asking it a community program that doesn't support a cardiology fellowship or like a difficult fellow.
Oh,
I think
I completely understand that. That makes sense. My point was like not to pursue fellowship within the same like maybe the same university hospital or something. Just like
Yeah.
in general to help us prepare to apply to for like a fellowship later, like once we're done with like this thing.
Okay.
I think you
I'll
can frame your question like this, that how the program is going to support and resident to build or to
To fight for
like to build or make our resume inclined towards our area of interest. That will generalize like whether fellowship or whether anything like how they are going to support our resume or build our resume in the line of our area of interest.
Okay.
Oh, that's a really good point, Dr. Sapta. I think that's like what you said is a better way of saying asking the question. I think that's good.
Yeah, because if we like focus on one area like fellowship or something, if the program doesn't have good fellowship or good research or something, then they will take it as a negative thing. So better to say area of interest.
Yeah,
Yeah, I
it's a
absolutely
good question.
understand.
Can you please repeat the question again? I'm just trying to have it written down. I have to write
I,
it down.
I noted down the questions. I
Okay.
sent it with the first question is autonomy of the residents. We can ask like about how is the autonomy of the residents in that program. The second is the parameters to evaluate a resident. If you want to change something about the program, what would that be? Then incorporation of AI into the patient care. How do you see that, and how do you like plan to bring it into the practice? And then program support for our area of interest. Anything else somebody wants to add? Because we just have 7 questions so far. Let's take the list to at least 10, then we can just shift to next question.
Don't you think some of the questions which we asked to residents, like they overlap with the PD? Like, one of the questions like, how do you help residents to cope with the workload or, burnout? So that we can ask to PD as well.
Okay.
So how do you rephrase, Ayush, this question?
It's a good question. I can directly ask them, how do you, I'll directly ask them what, like, how do you support, how do you try to cope with the workload of the residents? Like how the program supports the workload on the residents, workload that's on the residents. Something how you cope with the.
Yeah.
Can we ask a question like how the program is prepared to handle the emergency crisis time like we had COVID?
Okay. Yeah. Like this, yeah, if there's a mass casualty or even a pandemic like COVID-19, how your program, handle that? Yeah, something like that.
Yeah. So there is also one question. I think I will say, if your program was given a grant to make improvements, like improvements for any grant you like, millions dollar they get for improvements, how would you invest those funds?
The nature question. Sorry. Okay, you are saying how will they use the funds for?
So if your program is given grant to make improvements, how would you invest those funds?
Oh, that's a good question. Okay, like you are saying if a program is given funds to improve your program even more, how would you invest those funds?
Yes,
Or where would you invest those funds? That's a good question.
exactly. Yeah.
Okay. Any other question you have?
Can we ask like the program has any plan to guide the residents regarding the financial like investing or something like that, the saving money, or how do they support a resident whenever they run into a personal crisis?
I'm so sorry, I'm just noting down the question. How would you invest? Okay. So can you repeat your question if somebody wants to talk about this question?
Yeah, I just asked like if the program has some plan to educate the residents about the financial investment or something like that, or they have any plan to support the residents if they run into a personal crisis or something?
Personal crisis or something. Dr. Om, can you rephrase this question like in a better? How would you ask the program director if you are given a chance to ask this?
I'm thinking, the thing is, I think maybe it would be a little bit better if like the question was a bit more specific, because one of the questions like I had previously in mind tied to like, the vacation days were like what would the structure be for like a resident to make up time if they say, if they had to take time off more than what their like vacation days have been allotted, right? Like say like like their vacation days have been they've expended their vacation days, but due to some emergency they need to take some extra time off. What structure is there in place to for the resident to make up for that time? So how would that work? So I think a bit more specific question like in that sense, and with the specifics in mind, I think this is a good specific to ask. But I don't know if this is a question that can be asked to a program director. I think like it's a
I
question
think
better suited for residents, maybe.
I think I can try this. Uh, uh, so for this question, when people move from their home country to this US, and US is relatively expensive country, right? So we can ask this way, or something like this. Okay, so does the program help to guide about living in this expensive city? Do they support finances, or do they help in guiding investments? Something like that. Do you sounds good, guys?
I
Aishman, are you still writing?
No, I think like the question itself is, I think the way you phrased it is good, but I think like the basic, like the question that we're asking itself seems a little like this thing, because I think like if you ask them, I think the PD is going to give a very blanket, any program director is going to give a very blanket answer of like, I believe our stipend should cover the living expenses of a resident comfortably, and it is adjusted to the living cost of living of the local area, and we don't have any structure in place to help out a resident financially if they come hardships, because I don't think any program does. I correct me if I'm wrong. I don't think I've ever heard of any program that helps student in like financial struggle.
Also, I feel
Yeah.
like if we are asking such kind of question, this could be a potential negative point for filtering out. If they have two candidates, one is having difficulty like settling there, and another is comparatively comfortable settling there, then they will choose someone who is more adapting to that circumstances.
Yeah.
Like I don't think like there any program will like to like take extra burden like on an individual basis. That I feel.
Of course. So
Plus,
yeah.
I will also add that isn't it this question for with the human resources instead of asking the residents or the PD, right?
Because Indu, we get to see the financial advisors. People hire financial, even in India, people do hire financial advisors. Like I never needed that, because for that you need a lot of money to, to just know where to invest that money. But in US, people usually hire the, advisor, financial advisors to invest their money in the property.
I agree. Yeah, somebody asked that question. Remember, I just extended that
So
question.
that's fine. That's like, but like I would avoid, but if I'm running short of the question, then I might ask the program director something like this as well. So yeah.
Yeah, I mean, I think like considering the fact that like as Dr. Nisha said, like we probably have like 1 to 2 questions to ask the residents, 1 or 2 questions, and I'm pretty sure like us asking the program director anything will be at the tail end of an interview where we'll again get to ask like maybe 1 or 2 questions, and we've listed what like 15, 20 close to questions.
Yeah. I have noted
So yeah,
10 questions. So the last question that you told, how the program will handle if residents presents with an emergency, and how to cover that time if it is beyond the vacation time. Like how to cover that time if it's beyond the vacation. That's how like you are told, Dr. Om, that you would like to ask.
Yeah,
I have
the thing is, honestly, like, sorry, I just want to mention, like, the thing is, considering we have like enough questions, I personally would not ask this question because it kind of gives that impression that like the first question this guy can ask me any question, and the first question he's asking me is about a hypothetical situation where I don't have to work again,
Yeah,
right? It doesn't
definitely.
like it show like the thing is the questions you ask also kind of shows where your priorities lie,
Priority is
right?
okay.
mm,
Like in
Absolutely.
terms of vacation, I think like the only reasonable question to ask was that other doctor who mentioned about the maternity leave, because
Maternity.
that is a very valid question. And like, planning around like, having a child, it's an important thing for like a lot of people. So asking that question makes a lot of sense.
So
But
yeah,
like, I don't know, there are better questions than this vacation
mm,
one that I would
basically I just mean to prepare a list so that at the end, if
Mhm.
the conversation ends in a blind end, right, maybe
Yeah.
mm.
interviews for 25 minutes, but like after 16 to 17 or 18
Like,
minutes, there's a blind end, we don't have anything to discuss. So just to avoid a silence in the interview, so I read that watched on YouTube that it's better that we can ask the program, can we have few questions, would you like to answer them, then we can just go for one by one with that question, just to carry on the conversation so that it ends on a good note rather
um,
than
Yeah,
silence.
sounds good.
then, if there is a big university program invite and it's really big with a lot of fellowships and highly everything is so prestigious about the program. So can we differentiate like which one is the best to ask from those programs because they are very prestigious programs and big university programs? Just to be not silly about these, anyone has experienced any questions that are very best for such programs? And community program, I know like we can ask a lot of things and it does not that much matter as long as the university program, because they have a lot of medical students there, and to get selected at such university program is really important. So which one of these questions or any question is mostly very important for such programs? What do you suggest?
For me, the university program asking about the research or the fellowship would be like I can ask over there, like how do you support the research, or how do you support the resident research? Then how do you support, like somebody just told about, like Dr. Nisha only told, like she wanted to ask, like how do you support, how much do the program support, if you want to go to regional conferences or the national conferences, then we can ask
Mm,
fellowship. Anybody else wants to add anything to that? Like somebody just wrote something in the chat box.
university is eligible for any research grants.
Okay.
You can also ask about the policy making part, like uh, is your program is active in making policies or like creating newer quality improvement projects, especially for community service, or what are your unique ways to support the smaller communities nearby? Or academic part, we can ask what are your academic model for the residents?
Academic model. Yeah, academic model is something good, I think. Yeah, because about the research, mostly it's there, and I have seen a lot of programs have mentioned that even they support for research, and if you are PGY 1 to PG 3, they pay for all your research, like financial support. But I'm not sure about the other question is I think best one, the
And
academic.
that
If I
last
want,
question,
yeah,
like
go ahead,
how
sir.
your program is
uh,
going to support our resume for area of interest. That last
yeah,
question also you can ask because it has fellowships
yes,
and all.
yes, and academic one was also good. What was that you mentioned?
Academic models.
And another
Academic.
is about what are like is this all these big universities, they are actively involved in making policies in regulatory bodies and also like creating projects for the community service, because they have lot of fundings and they
Mm,
have a lot of collaborations with organizations,
yeah,
voluntary involuntary organizations. So that question you can ask, like
yeah.
how your program is supporting residents for community serving, for leadership, for
Hmm.
like decision making for the health policies. That
Yes. So somebody also has committed. Is there any mandatory research hours that we need to cover? Is this question for PT?
Like,
I
for
would
us, you
ask
can
it as like mandatory research hours. I think more like mandatory like research output. Like, are you like, expected to, attempt
Oh,
to publish like a number of papers or like, go to
mm,
a number of conferences, poster presentations? Is there some requirement like that rather than ours? I would ask if like there's a requirement for any of this. Or
yeah.
rather than requirement, you can phrase it like, again, the same thing someone mentioned that question. How much does the university support or encourage,
Yeah.
the residents attending like the regional or national medical conferences? I think that's a really good question to ask.
Yeah. Yeah, exactly. Thank you.
Running out of the question, I'll ask like some if like we are going to ask residents, what would program do to support the board exams? Like if I'm running out of questions, there are very important questions I can ask initially. Then like if I'm running out of the questions and there's a lot of time left, then I might ask them how will the program support the board exams? So yeah, I think
And
we're done.
bigger universities will say we don't have anything because
No,
it's
not
very
for
big
the
city.
university. In general, any program that I want to,
Yeah.
if I'm getting interviewed at any program, I can ask. Like later on, like as Dr. Om said, there's importance to every question, like the vacation one or the emergency one. If you are running short of time, if you have a lot of time left, then we can ask these irrelevant questions just to carry on the conversation. But at least have three important questions to be asked initially to the program director or anybody else, right? Maybe there are only 4 minutes left, and we could just ask one or two questions only because they even have to need to have give the answer to that question, right? So they might take some time to think.
Yeah, this is a good question. Like, what are the qualities? Someone typed in the
Yeah.
chat.
Lisa just mentioned about can we ask
Then
what qualities? Yeah, that's what like how would you evaluate the residents or like what do you expect from the residents? I've already noted that question. That's a good question.
so one time I sent the letter of intention, and then in return they sent me all the requirements for the residency residents they are looking for, like diversity, leadership, this we are looking for that. So I think for such reply, when I got it, so I cannot ask them again about what they are looking for in the residents, right?
Yeah.
Because they already replied such question. But one more question, can we ask the residents, there was one question that I'm misplacing. 1 minute, I will get back. I'm thinking.
Okay, that's even a good question. Like I've noted down when like we can ask the residents how the first year will look like. But yeah, the program director, we can ask them what do you expect from a first year residents. Yeah, that's a good question.
I have a question. Are these only questions for program director or other interviewers are interviewing?
Okay.
We are discussing only for the questions for program director, or there are other people also interviewers, right?
Like everybody of them, like I like.
Okay.
We're just discussing program director or any faculty, not the residents.
Okay. I would like to add one question. If the program supports research, then I would definitely ask, is there any elective time to do the research? Is program providing any elective time to do the research? And another question is, how many projects do residents get involved in during their training?
Okay. How many research projects?
And is there a formal seminar series?
What does that mean?
It covers the didactics mostly. When like we are interested sometime in giving seminars, and yeah, mostly it deals with didactic question. But I got somewhere this question: is there a formal seminar series? And another question I asked to the behavioral one faculties, how do they deal with the residents? How do they assist the resident? How do they take any classes separately? And how do they work for assisting us to the patients? Yeah, that was my spontaneous question actually.
Can you repeat the question again? I'm so sorry.
I have something to add what Nisha is asking. So, do we guys get like do the residents are given research opportunities, or is it optional, or is it compulsory? Do they have to really get involved with the research?
So mostly when I see a lot of like residents I've talked to and even a lot of my friends, they always have to present at least 1 or 2 case reports annually. So it is really mandatory mostly.
Okay.
Actually, the program I applied to and I got interview, they support research. And when I asked the question that how many projects do residents get involved during the training, they said that it's compulsory, mandatory two. At least 2 projects they have to be involved, and later on, it's their interest, and program is ready to support them. And regarding the elective time to research, yeah, they said that they have some time and everything. They explained it pretty well.
Okay.
Do you mean
Regarding
to
Yes,
research? Do you mean to
uh,
research throughout their residency? The minimum, right? That's what you mean?
yeah,
at
yeah.
least
You
2
should
have to be done.
Okay.
Yes.
So
So
basically,
According to them.
I want to know from the residents. I would like to ask about my communication skills and the English accent and everything, because as being IMGs, I feel maybe does this matter or not? I want to really know from them. Is this good question for the residents if we ask, because being IMG, we are not that much expert in the communication skills, or speaking English, we are not that much fluent. Does
Dr.
this matter or not?
Dr. Talpur, no, I asked this question personally. I
No.
don't ask others because I don't want to show them that I lack in communication in any way. Right? I have to show
Okay.
that
Yeah, yeah.
I'm with them.
Yeah.
Yeah,
Yeah,
this
Okay.
is not
I
a good
second that. I
question to ask.
sorry.
This will they will think that like then you are not like qualified for the residency post.
Yeah.
So
Okay.
this empathy and communication is something you cannot show that you are lack of by any means.
And
You are
everybody, you
like,
need to have
You
a
do
medical
want to ask a
accent.
question about language.
Yeah.
I would more ask
Language.
about learning like a second language. Like
yeah.
you can, like, for example, say you're like going down south to like California or like interviewed at
Hmm.
California, Florida. You can ask them, would I need to like learn Spanish?
Okay.
Does your hospital have a huge Spanish speaking population coming to you as patients every day? Would I again,
Yeah.
that also you can ask in a sort of like, would I have to like learn Spanish, or does the hospital offer any resources, or the program offer any resources or like guidance to like be fluent, like to learn Spanish as a second language, something like that. Do
Uh,
not like, I would
from
definitely would
residents, right?
avoid that. Yeah.
Yeah. From residents, we can ask such question. Okay.
Yes, from residents you can.
I want
Like
to add
definitely would avoid
something.
the English one.
Yeah. Okay.
So
Okay.
Kulud, I want to add something. So,
Yeah.
as compared to the, it's an IMG international, many Chinese, many
Yeah.
African and Latin countries, many people apply. And as compared to them, trust me, I heard somewhere, trust me, we people who are from Asia, like India, Pakistan,
Yeah.
Bangladesh, Nepal, we are pretty good in communication. And in China, they don't in Chinese usually don't, they are not allowed in English in their home country. So
Yeah.
they struggle with English. So as compared to many other IMGs, we are pretty
Yeah.
at a good position. So no worries. All
Okay.
right.
Okay. Thank you.
Yeah. So Dr. Hamad has mentioned few points that are very good. How many PAs and how many residents? We can ask these questions to the residents. Dr. Hamad, can you share in the group whenever, if it's possible? Yeah. We can ask these questions to the residents. Yeah, thank you so much. So now should we go with the, like, we are done with these question part. So I'll just share in the group whatever I have noted and you could just see if you want. So now should we move to the real question?
I have one question.
Go ahead.
So I have one interview which is like in person and it's 2-day interview, and second day is like site tour and meet and greet and dinner with residents. So what kind of questions should I include on my second day? So I have to, like, what kind of conversation should I have with residents and others on second day?
So if there's any repeat applicant who has that experience, you can share that with Dr. Nivedita. Like if somebody has experience with that here. So for me, Dr. Nivedita, it's my first time. I don't have any experience. But what I do is, instead of preparing that conversation, I would try to interact with as many people as I can. Like even
You
their
know,
faculty. members, I'll just show them, I'll just try to be in touch with everybody and let them know that I am one of the applicants for this residency spot.
How many hours
Mm.
in person? Because I'm also invited for in-person interview. So how much is the time did they mention? Can you please tell
So
me?
yes, in my first day they have mentioned it's like 4 hour interview, and
Oh,
they will provide where to stay at that very night. And second day it's like meet and greet and dinner. So I think I have to stay there whole day.
so for meet and dinner time, that's all like very casual. I will say it is not. You don't have to worry about that and be just yourself, because a lot of like my sister and all, they just say that in the dinners it's really nice and you just don't ask anything formal. Just be casual, be yourself, and dress well and everything. But for the first day, I would say, like, yes, in-person interview for first day questions, but dinner and this, don't worry. Just be yourself.
And what about dressing sense? Like first day will be formal, and second day,
Yeah,
like
so
should
the
I
formal,
also be in formal dress or like what?
yes. So for the first, I will go for like the very formal, like a coat or something. For
Mm-hmm.
interview, for the dinner and this, you can wear a dress and stockings or something like, and cover yourself well, and but wear good dress or something, branded stuff,
Okay.
and that you can also
Okay.
return later if you're like I would like to save money, but I would also like to have wear something branded and good, and then you can return.
Okay. Thank you so much.
So should we discuss the question now? Like, if somebody asks you what element of the nature, you will be just, repeat those. Let's repeat those questions. So Dr. Nisha mentioned about 3 questions that she was asked in the interview. First would be what element of the nature you will be, if like any water, river, anything you can just relate to. Second question was, if you're leaving, you've done with your work for the residency, in a day of a residency, you're done with your work, but your attending tells you to present a case, how will you deal with that situation? The third question is, she was asked that if you like if your relative if your close relative is diagnosed with a life-threatening disease, how will you convince him to get that treatment? So anybody wants to answer any of that question? No, and just remember, no question is right and no question is wrong. No answer is right, no answer is correct. You can just put across your point and we might learn from that.
I have a doubt, like how to know which program will send the in-person interview and which program will send virtual. Are they going to give you
When you
enough
will get
time to?
interview, they will mention it in the email.
So how much time mostly they are giving? Like just I'm asking, if someone is in India
You will get
and then
sufficient time, like over the interval of 2 months or 3 months, to
So
choose what
oh,
kind of. But one thing I have learned from like this interview, because this is my first interview, I have never I applied for the first time. So one thing I have learned from this, that whenever you get interview, just go and book it. Otherwise, you like very few slots are left.
yeah, and
So I
also
was deciding, oh, what to do, how to do. So you have to create account on that Thalamus and then just book it whatever you want. You can change it later also.
Do they
about the
give you
in
do they give you a choice? Is it in person or virtual? Do they
no,
give you
No, it's
I
specifically.
didn't get any choice. I have to do in person.
no, I did not get also. But you know what? What I noticed is the programs there in within the state that I'm living, because I'm resident here. So those programs, like I'm in Pennsylvania, so those programs are mostly asking me to come and have in person. But programs like apart from the Pennsylvania, other states are asking me to be virtual. Maybe they even noticed that. I'm not sure.
Yes, that might be the reason, because I am in California and I got invitation from California.
Exactly. See, this is happening. Yeah.
So most of the programs, like when I was searching from them, they mention on the website that the program is going to be, interview is going to be virtual, or it is going to be this. The program is going to be virtual, or interview is going to be virtual or in person. So mostly it's, I think they already mentioned it's going to be in person or it's going to be a virtual one. And most of them were the virtual ones. When I was searching, there were a few programs that were offering the in-person interview, but most of them were the virtual one because it's comparatively cheaper for them instead of arranging it on site, because they have to do a lot of things like maybe a meet and greet dinner, a dinner before the interview, dinner after the interview, then on-site tour and everything. So it is very costly for them.
So they did not mention in my interview details about in person that they will support me financially or book hotel for me. Was it should be mentioned, or I don't know about that thing. So does anyone know about it? Is it mentioned when we get the in person? Because I did not. They did not mention for me any hotel stay.
As far as I know, I haven't gotten any like interviews. I have no experience, but like I've never heard like a program sponsoring someone like to come, as in like covering the costs of travel,
Yeah.
come and interview with
But
them.
in mine, it's
But
written
also
that they
like
will
one
cover
thing
the
I
night
think like,
stay.
sorry.
I'm saying in mine, they have mentioned it that they are covering the night stay
Oh,
and food also.
that's good.
Okay.
Yes.
I think they will mention if they will cover. Okay. Thank you. Yeah.
Yeah. And I think like once you're like sorted with the interview, like once you've been selected, like invited for an interview, I think like you'll be put in touch with their HR department, and I think you can ask them for example, like if you're in India and you're not able to make it for an in-person interview, I think they can accommodate you for like an virtual one. So I don't
Yeah.
think that should be an issue. Like you just need to the other doctor said, you just need to book it like quickly. Like you need to be fast about it. That's the only thing. Contact them as soon as you get the interview, and then like lay down explain to them everything. So you're just giving them time to work with you.
So I have a question here. If you're in the same state, then why do you need a room or accommodation, right? So you guys were saying that in person was if you're in the same state.
That's
So
an assumption.
just wondering. Sorry?
I think that was an assumption from their side. Like nobody exactly knows like what the thing is, but
Okay.
since they're from
No,
the state.
the thing is, I think that doctor who mentioned it, she mentioned that she's a permanent resident. At least when she said she's a resident, I think that's what
Yes.
she meant.
Yeah.
Oh,
I'm
so
perfect.
Oh,
yeah. So
okay.
when you say you're a permanent resident, it's implied that like you live here.
Yeah, I live
So
here.
therefore that
Oh,
assumption is there that she can just come, like because like they just assume she lives there and she has a car or like
so
can travel.
no, my question
So
is,
yeah.
they got interview from the California, so the candidate is residing in California or like
Yes.
that.
Yes. Yes.
Okay, so yeah, so if that is the case, I don't think the program will sponsor of any like stay, I believe. But if they're offering, then it's really something great, I believe, because I don't think there's a necessity for them to offer, right? If you're coming from the same state. So that's my assumption here again.
I think they are like supporting or like paying for accommodation because it's 2 day interview and they want to like second day also recommended. So
Mm-hmm.
that's why.
Yeah, that's really good. But I'm just saying, if you're coming from other state, I think it's like they will sponsor for the night stay. That's what I'm thinking because I've heard someone saying that if you're coming from a different state, they might provide you a night stay. I don't think about the travel. They don't sponsor for the travel though.
It's mute, I think, Aishman.
Oh, I'm sorry. So if given a chance to me to do an in-person or virtual interview, but if I can afford my travel to US, then I would go for in-person, sure. Otherwise, I would go for virtual. Anybody else wants to answer, Dr. Priyanka?
Sorry, what was Dr. Priyanka's question? I think like it was on mute. I don't think I heard it. I'm
Yeah,
sorry.
if you get a choice for in-person or a virtual interview, does it make a difference or either is fine?
I think either should be fine. Again, like I'm just like basing this off of this thing. So I don't like, I'm not like super comfortable with like what do you call it? Like making any assumptions because I don't have any experience as of yet. But I think like in person should be better because like I mean like they get to see you face to face and like it leaves a better impression than like through this thing, right? But again, like affordability and like if you have to come from like outside, like from India, you have to travel, like then it can be problematic. So I think it's like a case by case basis. At least that's how I see it.
For the travel, they can travel to US because going to US, staying there is another 3 to 4 lakhs of expense. If somebody can afford, they should try to go in person and have a small vacation in US as well. But if somebody cannot afford, then it's better to do it virtual only. Yeah, again, that's the and like Dr. Jenny, I mentioned if we schedule an interview via Eras, if I ever get an interview via Eras and I schedule it, then I would not know, like I don't have to notify the program, but I will send a thank you email to the program coordinator and I'll notify that I have chosen this date, particular date for my interview. Yeah. So should we go with some question or like should we go with a question? If somebody asks you, like, what element of a nature you are, how would you answer that? Anybody wants to give the answer?
I think I'll go for the tree, and I would like the tree.
Answer the way if somebody asking you during the interview, how would you answer that? Like it's
Okay.
a spontaneous question.
Because it's spontaneous, I'll go and I'll choose the tree to be a tree because that is the most resistant to all the weathers. And being a tree, I think it is hardcore, and you know how to be stabilized at the position, even though the weather conditions. But the tree is always there. It's long lasting. It has all the capacity to observe. It's always there to look at the environment and different conditions. And yeah, so I'll go for the tree.
Okay. So anybody else wants to answer this question, or we can even discuss these questions tomorrow onwards as well. Like today we are done with the questions and we got a good insight from Dr. Nisha as well. But your answer is very good. Yeah.
I haven't thought of it, but if I could be any element in the nature, then I would choose to be a river, since river is constantly flowing. And the one thing that I've learned in my life is change is the only permanent thing that happens. So being a river means that you get to constantly adapt to new environment, and river also provides nourishment to the plants and animals. So I would also be a source to nourish life. So I would be a river.
That's a very, very good answer. That's again a very good answer. Like again, I want to be a river because and I would add that river is very flexible and always adjusts to whichever path that river gets. So I have that flexibility and adaptability inside me. And as you told, it flows continuous. So I would say that I have that continuity in everything. I have that willpower. I feel that I have that kind of willpower inside me. And again, it's long lasting and it provides the nourishment to the plants and the life, around the river. So yeah, I even like to help people. So I would relate to that element. Yeah, that's a very good answer, Dr. Lisa. Thank you so much. Anybody else wants to answer this? Dr. Om, do you want to answer like what element of the nature you are?
Yeah, I'm just like I just need a minute to like think about it.
Okay.
Yeah.
Okay, I was thinking about the elements. See, the water is the element. It can be the river, as one of our participants said, river. So is river the element, or the water in the river is the element here? Because water can be in clouds, water can be everywhere.
Yeah.
I didn't understand
No.
the question. So do we it with the element or
So
anything?
basically, remember when we study about the stars and astronauts, we are like four signs like water, fire. I think these are the main elements, and then whatever comes that is included within, I think. But the fire, water, they
Nobody is going
themselves
to
are
wait.
elements,
I
right?
Yeah,
think like
five elements: fire,
if I think like the
earth,
question is
air,
kind of like
Earth,
vague enough.
water,
Sorry.
and soul.
Hindu, I
I
do.
don't know. I always thought like the question was vague enough that like, like answers like rivers or trees also can work because technically they are elements of nature, right? Like I think
yeah.
it can work. Again, it depends on like how you describe it, right? I don't think you have to stick to like fire, water, wind, air, like all this like Naruto,
You-
anime power shit.
Yeah, Naruto. Yeah.
And no answer is going to be wrong. See, they just want to know our viewpoint. That do we have they just want to see that whether we are sane or not. Whether you say fire, whether you say water, any other element, they just want to know our perspective,
Mm,
right?
Yeah.
They offer
Not like Avatar.
based on that question, right? They're not going to offer us offer or reject us a residency spot based on, but I think they just want to know our understanding and like our thinking and our perspective. So that's what I feel. But yeah, I just keep that in mind as well that trees is not a element.
mm.
Yeah. Otherwise, I can talk about water, like how flexible the water is and how it provides the nourishment to the people staying around it. As
What else?
Dr.
Like tree, river. What else? Any other question? How would you say, doctor? What would you say?
Anybody, Dr. Om will just take some time and answer this question.
What about you, Dr. Aishman?
What is your answer,
The
Aishman?
river, like Dr. Krishna even mentioned, the same points I have. The river is very flexible and takes the shape of the path. Wherever the path it gets, it takes that shape. Then it provides nourishment to the life and the animals around. And third thing is it keeps on flowing continuously and it's very long lasting. So I would say river. Like that's what I had in my mind. Like and even Dr. Lisa had the same points as me. So for me, it's a river. Anybody else wants to just tell them what element they can relate to? Dr. Harshita?
I think I probably would relate to the sky because there's so many variables and changes that happen, and I think as human even we face uh like changes in our lives and like probably the behavior or something along those lines. I mean, I haven't framed the question, I'm sorry, answer, but
Yeah. And one more point why I relate to the river is that by any way it will make its end to the into the sea. By any way it will take any path to reach the sea and finally drain into that. So it will just strive to reach its goal. So that's why I relate to river. Anybody else wants to just tell them what element they can relate to? Will have interesting answers. Dr. Jaideep, do you want to answer this question?
I I I didn't think much about this. I'd probably say I'd probably say fire because right now everything is so volatile. Everything seems to be going up in a smoke. But again, I I can't think of an answer for this question.
Okay, that's perfect. No problem.
Can I try?
Yeah, sure. Go ahead, Dr. Bet.
If I were to become any part of nature, I will be like flower, which can be simply uh, give a joy and variety to the surrounding, and also it will give the color and beauty to the landscape. So, so
Yeah, that's even a very good answer.
also someone could say like mountain who can stand strong and tall, and also give the representative of the resilience, endurance, or sense of grandeur. So mountain also sometimes it could be. Thank you.
Yeah, that's even a good point. Like I can even say that I like Himalayas.
Yes.
That's again an element of the nature because how they protect us from the like in the previous times, how they protect the insurgents in the Southeast Asia from the Middle Asian countries then how it has been there for a very long time, how it has been very long lasting, and how it controls the weather and everything. That's even a good point, like the mountains. Yeah,
I'd like to contribute.
sure, go ahead.
Hello, everyone. So I'd like to be a tree because actually my name in Arabic is roots of a date tree. I feel the roots unite nourishment, provide nourishment to the tree, and gives the foundation for a tree, and supports everything for the tree. And I believe that as a tree, I provide oxygen for everyone, so and bringing everyone together.
That's again a very good answer. Very nice. And Dr. Om, are you ready with your answer?
Yeah, kind of. Okay, so if I had to relate myself to an element of nature, I would relate the best to a night sky very specifically, because I think like over the course of like human history, we've pretty much figured out a lot of stuff on Earth. Like, I'm not saying like we figured everything out, but like we've gone pretty far, right? But the night sky kind of symbolizes just how much is left for humanity to learn, and that just kind of like fascinates me. Just and like the implications it has for like the human race and like understanding and knowledge. So so like I feel like that is reflective of my nature. Like, I'm very curious, I'm always excited to learn and like figure out new things. And like when you figure out new things, you also understand this just the scope of like what you're trying to understand. So I relate to the night sky, and like as a side note, I love stargazing. Like it's one of my like favorite things to do. So yeah, I think that would be my answer.
I don't know how you come up with such good answers every time.
Thank you.
That's an art actually that we need to learn from you.
Thank you so much. And it's just like these are just my like honest thoughts. Like I've always like I like the night sky. It's kind of especially like when you go out of the city where like there isn't as much light pollution, you can actually see the stars. It's amazing.
Of course, that's a good answer. So Ishita, do
Thank
you want
you.
to ask a question? Ishita or like Ishan, do we have Ishan here?
I liked Ishita's response on the chat. Diamonds. So diamonds, they are like carbon, but they are produced under the tremendous pressure and take a lot of time, and they can sustain. And diamonds are used in many factories and many processes where hard element is required to drill and all those.
They're used in medicine as well.
Really?
Diamond edged
Yes.
like blades are what are used for performing ophthalmic surgeries, because the cut is like so clean and like precise.
Yeah. So see, we have so many interesting answers. Anybody wants to
I
ask?
also want to try for this question.
Go ahead, please.
So if I get chance to be an element in nature, I would like to be Earth, because Earth is like a mother and it's provide nourishment and place to live without any discrimination to living beings as well as non-living beings. That's all.
That's a very good answer again. So yeah. So like from tomorrow onwards, we'll have more of these behavioral questions, because I think we have covered all those questions, your strengths, your weaknesses, this and that. We have covered all those questions, I think, even twice. So now we'll just go with these behavioral questions, like what animal you can relate to, or you can just post the behavioral questions in a group. I'll just compile all of them, and we can just practice it here and on our own as well.
Okay.
Instead, because we are done with most questions, like there are only 5 to 6 questions that will be rephrased every time, and they will be asked in the interview, right?
Can somebody help me with the question? I did not like come before. So how can you contribute to US healthcare system? Can you answer that for me?
Anybody wants to add to that?
US healthcare system, how would you contribute?
Indu, do you want to answer that question?
Okay, healthcare system. Okay. Who's asking? Veer, can you repeat the question?
What can you contribute to US healthcare system?
Oh, how can we contribute?
Yeah.
Okay. So I think that day, like my answer was like we have come from my home country is India, and we have come from a country where we have been exposed to a lot of hard work, and also in the OPDs we see a lot of patients. So the the patient load, we have learned over the time how to cope up with the patient load. So that way I think I can cope up with extra work if required. And secondly, uh, what do we also Ayushman, do you remember we also talked about alternate medicines in India? So I don't think we can contribute that way. What else we can add to that?
So
Give me
yeah,
ideas.
I just you gave a very correct answer, but yeah, we can just use the word. I can bring the adaptability and efficiency. What I learned from my home country, the US healthcare system, that I can just add. I can bring the wide knowledge of treating various diseases in my home country that might not be present in United States. I can bring that knowledge of treating those patients to the United States healthcare system. That's what the 2 points I remember. We, as one you mentioned, and other one was this. Anybody else wants to add any other point?
Also, we talked about yoga. So yoga is a form of exercise. It's nothing to do with any religion, and that gives a holistic well-being to the patient. And I can help integrating that as well. So that might help, right? That was also a point that day.
We also, right? And resilience.
Sorry, can you repeat, Dr. Harshita?
The adaptability and resilience. I think someone mentioned it, like working in the Indian healthcare.
Yeah, and somebody even told that they had experience working in various countries, and they can bring that experience to the US healthcare system. Like somebody told that they worked in Kerala, then Middle East, and for a few years, and they can bring that experience to the US healthcare system. Dr. Om, do you have anything to add, or anybody else has anything to add?
So as a
Sorry.
Yeah.
can I give point about my speaking skills? Like I have been hosting a lot conferences, and I have been hosting a lot of projects and things like that, and actively working as a research assistant. So can I present that? How can I say that how can I help in that healthcare system according to that perspective, as being a researcher and a host and a speaker? Can you explain
Dr.
any
Om,
points?
can you explain that for us, for her?
Yeah, I just want to know how to say those words, like how to incorporate my own, CV and experiences into this. I'm having difficulty about that.
Dr. Om, can you just
You can just, I
You
think
said
you
you've
can just
hosted,
say,
correct?
Yeah.
So then you can talk about like leadership qualities. You can talk about like how you took the initiative and
Okay.
how to host these conferences to maybe broaden knowledge or like bring in more people to become to get them familiar with the US healthcare system, something like that. And you would continue doing that like in the future as a
Okay.
resident or like as an attending, whatever.
Okay, thank you.
So yeah, that's how I would phrase it. Like leadership skills are the words is what I would use.
I'm taking a leadership roles. I like doing that, and you can bring that to the US healthcare system and work with that in future as well. Hey, Dr. Harshita, you were saying something?
Like I spoke about the resilience and adaptability. That's what we wanted to add, right?
Just yeah, I think somebody was just saying, and so yeah. Anybody else wants to add something, then we can end the meeting. Tomorrow onwards, we will take the behavioral questions only.
And I think one more point here I would like to add, being like because I'm from Dubai, so we had a lot of diverse patients from different countries and nationalities. So I'm kind of used to working with diverse patient population.
Yeah, I think you only mentioned that point that I worked in two healthcare different countries, and I can bring that knowledge to the US last time. I think like that person mentioned about that she was working in US. She was working in Dubai at that time.
Again, the diverse population thing, like expand upon it a little bit. Try to make it like how. What would you bring? Like, would you like bring like a level of like cultural sensitivity to
Yeah.
a hospital with like a patient like diverse population? I think that's how you should talk about it. But
Okay.
yeah, definitely you can use that point that like from your experience that this is what you this is what you're bringing.
Okay. Thank you all.
No problem.
So should we end the meeting now? I think we are 1 hour 43 minutes into the meeting. So we can just continue with the behavioral question. Guys, you can just post the behavioral question, whatever you think, and we can discuss. Like it's interesting to listen to different answers, and we can learn at the end of the day.
Yeah. So there was one person, they got interviewed, and I don't know, it was here or somewhere else. She mentioned about the tree, and it has 5 birds sitting there. Did you hear about it? Did you hear about that question? Somebody
Could you
told
say
us.
again, Karan?
Oh.
So there was she got interviewed, and they asked her for there was a tree and the 5 birds were there, and there was a gunshot. They did shot the one bird, so how many birds were left? So such question, and then she mentioned that I said all the birds were, because they fly away because of the sound of the shot, so no bird was left. So
I think nobody mentioned that. You must have heard it somewhere else.
oh, yeah. So this was a question she was asked from some of the people at the residency program. Was it residents or somebody? They asked this question. Because all the birds will fly because of the sound of the bullet. So yeah.
What was
Such
the
question.
in this
I don't know.
Don't you
It
think?
was
Don't you think
kind of
one will be shot out of those 5?
But all of them
I still didn't understand the question. There were 5 birds sitting on a tree, and like a
birds on
gunshot was heard. And I'm sorry,
gunshot.
what was the exact
So
like question in this?
they shot the
Sorry.
one bird. 5
Mhm.
birds there, and they shot the one bird. So how many are left? None is left because they all flew away.
Okay.
No, but they shot one, so one is dead over there, right?
flew up.
How many are left on the tree? How many are left
If
on the
you
tree?
want to do mental gymnastics for this question, you can. You can be like, technically, the birds are alive. They are there. They're just not on the tree. I mean, this is like.
Don't get my question right. You have to
If
post it on
the
my
program
Instagram.
kind of asked me this question, then I'll think twice. I'll be like, do I want to go?
I don't know. She mentioned that she answered all will fly away because of the sound of the gunshot, and that's what she.
Okay.
These are
Are
just the
they
questions somebody asked. Like if they a wrong answer, then you have to post it on an Instagram story, giving them the credits.
Are they trying to say that there were shootings in the hospital or something, and then what would someone do?
No.
So yeah, then maybe like the follow question was like, their follow question like, okay, there's no tree and there's no birds. Instead, there's a hospital and a bunch of residents. What if you get shot? What will you do? Maybe that's what they're trying to do.
But that's very, I don't think that nobody should be saying, everybody should be saying enough not to ask these questions. Obviously, I'll save my life first. I don't want to be a superhero there and just, stand in front of the gun. Depends on the road itself. So should we end the meeting? Tomorrow we'll meet, go more with the behavioral questions.
Okay.
Right?
See you
Thank you
guys.
so much for joining, and tomorrow let's meet. Then meet is becoming very interesting day by day.
Thank you, guys. It was nice meeting you all. Thank you. Bye.
See you tomorrow. Do we have
Thank you.
today?
Thank you.
Thank you so much, Dr. Sapta. Do we have Dr. Surya with us today at the meeting? Share the recording. Thank you so much. Okay. Have a good day, day or night, depending on the time zones. Bye.
Thank you.